Thank you so much. Appreciate that, Bonsai Betty. All right. Well, you can see that the waves are pretty gnarly and tasty in that video. We want you to have good eyesight, and every Monday morning we get to ask a specialist. Dr. Rupa Wong joins us once again, an ophthalmologist with over at the Queens Medical Center. Good morning to you, doctor.
Good morning.
Okay, let's show some imagery here, because we had talked earlier about dilating eyes and eye exams and the importance of having them. What are we looking at right here?
So this is actually my eye. This is my retina. So when your ophthalmologist putting on that crazy headset and using that lens that blinds you and after dilating your eyes, this is what we're looking at. That ball in the middle is your optic nerve, and those are the blood vessels, the red vessels emanating from it. And that black spot that's kind of in the center, that's normal, that's your fovea, and that's where things like macular degeneration, diabetes can occur. Everywhere in the retina is what we're looking at when we dilate.
Okay, doctor, I hope this is not too forward, but you have a beautiful optic nerve.
Thank you.
So when you are doing the eye exam, what are some of the important things that you're looking for here? So when we're seeing this, some of the things that you're specifically looking for and that might be red flags for you.
So the first thing I look at is generally the optic nerve. I'm trying to check to make sure that there are not areas of thinning, there's not areas of blacking out, which would be signs of glaucoma, that it doesn't look swollen, could be sign of a brain tumor. I check the blood vessels to make sure that they look normal caliber, that there's no bleeding areas in the retina. Those would be signs of diabetes.
So you like to see those really precise, clear red lines, and that means it's a nice, healthy eye.
Nice, healthy eye, nice sheen to the retina if they're young.
Okay, obviously I'm at one end of the spectrum, but I have children. When would you advise parents to take kids in for an eye exam?
I get this question a lot since I'm a pediatric ophthalmologist. Most pediatricians should be checking kids' visions between 2.5 to 3.5 years of age. That's when they're most cooperative. They're going to start to be able to read the eye chart. Even if it's not letters, it can be numbers or shapes. If they don't get a good vision within that time period, they'll try once. If they don't get it the second time, then they should refer to a pediatric ophthalmologist. Of course, if you come, bring your child in if you have any concerns, if you notice eye crossing, if you notice that they seem to be squinting or closing one eye, having headaches, those are all reasons to refer to a pediatric ophthalmologist earlier. But I can actually check vision. I've given glasses in babies as young as 1 year old.
Wow.
Yeah.
Okay. Dr. Wong, thank you so much for sharing with us on this Monday morning with Ask a Specialist. Thank you so much. All right, so to come on Wake Up Today, we have much more ahead. We've got top headlines coming up.